the question of the role of molecular testing in early stage non-small cell lung cancer, whether this is something that we do routinely or only within the context of clinical trial. This is a very important question, not just in terms of a specific patient, but also in terms of the way the field is moving forward. There are several considerations that one should pay close attention to in making the decision whether or not to test patient up front. It's not so important to test, but to decide on what you're going to do with the result of the test when you get it. So at our own institution, we have a policy of testing all patients with advanced stage non-small cell lung cancer. For those with early stage lung cancer who go to surgery, it is done on a case-by-case basis. If, for instance, we have a patient, even though we know it's early stage, but where we fear that they may suffer from disease recurrence sooner rather than later, we go ahead to do the molecular testing in those patients so that we have the information handy if and when we need it. This is also part of the recommendation by the American College of Pathologists as well as the IASLC Joint Task Force, which is to decide on an institution level whether or not the resources are available to test all patients, irrespective of the stage of the disease, or you only test patients that you are ready to treat with a specific agent. My inclination would be, given what we know about lung cancer, which is that even for patients with early stage disease, recurrence is more likely to happen than not. So if the resources are available without stretching the laboratory capacity to the limit, I will favor doing this upfront to have the information available. The other consideration is the field is now moving into incorporating some of the targeted agents in the adjuvant setting. So it makes it even more relevant that we know what the molecular status of these patients are so that we can at least encourage them to participate in some of these clinical trials that are about to start, like the Alchemist adjuvant study for both ALK as well as EGFR mutant non-small cell lung cancer. I wish the same would be true for small cell, but currently we do not have the opportunity to diagnose the disease very early in patients, as well as to molecularly characterize the patient. But my vision and hope is that in the next couple of years, based on the work that is being done from different centers around the world, we may actually have the opportunity to offer targeted agents for specific subtypes of small cell. For instance, PI3 kinase mutation is known to be fairly common, relatively speaking, in about 7% of these patients. This could be one of the ways by which targeted agents could be offered to those patients.